Hello to my fellow healthcare colleagues and welcome to the Healthcare Motivation Channel. This channel exists to honor and uplift you. If you find value in this message, please like, subscribe, and share this video with a colleague to encourage and uplift them as they care for others. Today's topic is about experiencing grief and loss in healthcare. You are the steady hands and compassionate hearts we rely on in our most vulnerable moments. Your work is a profound gift, often uncelebrated between emergencies and long shifts. The path you walk is not easy. It's filled with both triumphs and heartbreaks. This weight is real, and it follows you home, replaying in your mind long after your shift ends. Recognizing these demands is the first step to building resilience and sustaining your vital mission. The emotional strain on healthcare workers is a measurable crisis. Nearly 1 in 4 healthcare workers is considering leaving due to burnout, a loss our system can't afford. Physicians face higher suicide rates than the general population, highlighting immense pressure and isolation. Over 60% of physicians report burnout, and more than half of nurses experience anxiety and depression. 80% say their workload has increased, leaving little time for recovery. These numbers represent real people, our colleagues and friends. We can't ignore these signs of distress. Acknowledging this reality is the first step toward building a healthier, more sustainable environment. To navigate grief, it helps to have a map. Elizabeth Kubler-Ross described 5 stages: denial, anger, bargaining, depression, and acceptance. Denial shields us. Anger follows as reality sets in. Bargaining and sadness often come next. Acceptance means the delicate adjusting and learning to live or move forward with the loss. These stages are not linear. People can move back and forth between these stages. Recognizing grief helps us heal and support each other. Beyond grief, you face compassion fatigue and decision fatigue. Compassion fatigue is the cost of caring. It involves emotional exhaustion from witnessing suffering. It can leave you numb and disconnected, eroding your empathy. Decision fatigue can come from making countless high-stakes choices each day, draining your mental energy. It is important to note that these are not personal failings, but predictable hazards of caregiving. Signs include emotional blunting, irritability, and feeling dread before work. Naming these experiences helps you address them directly. Primary care physicians are especially vulnerable, balancing deep patient relationships with systemic stress. Recognizing these pressures is crucial. We must ensure that all caregivers have tools to combat these challenges. You don't have to carry this weight alone. Seeking support is strength, not weakness. Peer connections, formal or informal, offer validation and community. Support groups, professional counseling, and resources like the Substance Abuse Mental Health Services Administration in the U.S. can provide vital help. The 988 Suicide and Crisis Lifeline is available for any emotional distress. If you don't need it, please share this information because it can be a lifeline to someone in need. It is important to be proactive by saving helpline numbers, identifying local support, and building your mental health toolkit. If you don't need it, Please keep this resourceful information on hand, as it can serve as a lifeline for someone in need. As for you, hold your head up and prioritize your well-being as you care for others. Support each other and access help when needed. Your compassion changes lives. Remember that you are not alone on this journey. Reach out for support and resources from your local health clinic or hospital or health department. You can also reach out to the Substance Abuse and Mental Health Services Administration's National Helpline at 1-800-662-4357. And call the 988 Suicide Crisis Lifeline for immediate and confidential crisis support 24 hours a day, 7 days a week for anyone experiencing mental health or emotional distress. The call is free and confidential. Thank you for tuning in to the Healthcare Motivation Channel. If today's message inspired you, please click like and subscribe. Share this video with a fellow colleague or caregiver to encourage them and help them feel supported on their mission of caring for others. Stay motivated, stay focused, and we'll see you in the next video.